Hello, come on in, take a seat. My name is Lee and I'm the medical assistant that'll be bringing you back, taking your vital signs and just sort of identifying what brought you in today. What time was your appointment at today? Okay, and can you confirm your first and last name? And your date of birth? And let me see, any changes to address, phone number? Okay, any change in emergency contact at all for you? Okay, and who is that as far as relative, friend? Okay, gotcha. And any change to your pharmacy? We're good there? So it looks like we have you on the schedule today because you've been experiencing some burning with urination. Okay. And how long has that been going on for? Okay. Have you tried taking anything over the counter at all? Okay. Yes. Yep. Totally get that. And let's see here, as far as general medical history, when was the first day of your last menstrual period? Okay. And then any changes to your medical history? Are you taking any new medications that we don't have on file? You're okay there, okay. Okay. And then let me see here, any changes to surgical history, smoking or drinking status, did that change at all? Okay. And any new changes to family history, whether it be new diagnosis of breast, ovarian, uterine, colon, or cervical cancer? All right, and then any change as far as your current relationship status, any new sexual partners since we last saw you? Okay, and are you using any forms of birth control, whether it be barrier methods or anything hormonal? Okay. All right, let's see. So, we are going to get a chart started for you. Any vaginal symptoms today? Abnormal discharge, odor, itch? Okay. Any pelvic pain? You kind of just feel like a fullness and pressure in the middle. Okay. Any abnormal bleeding, any vaginal bleeding outside of your menstrual cycle? Okay. Oops, someone's car is going off there. So, how about we get started then on obtaining your vitals? So I am going to start the chart here for you. So first things first, let's get your blood pressure first. When you first came in, do you mind giving me your height and weight for me? Okay. And how tall are you? Okay, awesome. All right, I am gonna put all of that over there. Just gonna put some hand sanitizer. Do you have a preference on which arm you would prefer? Okay, just want to make sure. All right, so I am just going to open this for you. If you wouldn't mind sliding your arm through there. to take a quick listen, so bear with me. You can actually, if you want, rest your arm on me there. Perfect. Blood pressure is normal. Let me take this off of you. Have you slide your arm out. Perfect. Let's just pat this up. How has your day been going so far? Good, good. Mine's going well. Thank you for asking. Let's just put your blood pressure here. Next up, we're going to do a temperature check. Have you been feeling any fever, chills, generalized fatigue? Okay. All right. Got a new pack of covers here. I have not used this one before, so bear with me. Let's see. It says insert here. Awesome. Ooh, fancy. Very nice. Messed up somewhere there, but I like it. Okay, this is going to go right underneath your tongue. Few seconds to kind of work here. Temperature is normal, so no signs of fever. So that's very good. Let me put this back where I found it. Let me throw this away. Alrighty, so temperature is good. Now, are you noticing any other symptoms at all? Peeing more often, urinary urgency? Like, do you find yourself going to the restroom more? You do, okay. And then we have that pelvic pressure and fullness. Okay, so I think what we are going to want to collect today before Leanna the PA sees you is a urine sample. Basically, we're just going to dip that urine sample to see if it shows any bacteria, blood, or nitrates, which may indicate a urinary tract infection. Have you ever had a UTI before? This would be your first time, okay? And then she'll just want to do a physical exam. Now, you won't have to particularly get undressed or anything like that. She may just want to press on your belly, tap on your back, and then just kind of do like a general assessment of your face to make sure you're not showing any signs of distress. That's all right with you? Perfect. So yeah, I'll probably be an abdominal and a back exam. And then I will, of course, show her all of your vital signs. So we should be all set there. Let me put your information on this pee cup. And this is where you're going to want to leave that urine sample for me. You'll come bring it in here you can just kind of wrap it with this paper towel, okay? And there are extra paper towels in the bathroom for you. But do you have absolutely any questions before I step out and Leanna, the PA, comes in? Think you're okay? Awesome. All right, well, I'm going to give you some privacy and then she will be in soon. All right. Hello, it is nice to see you. My name is Leanna and I'm the PA that will be doing your physical exam today. Lee, the medical assistant, was just telling me that you've been having some burning with urination, as well as feeling like you're taking more bathroom trips. It looks like she did get your vital signs. Your temperature was good. You haven't been experiencing any signs of fever, chills. Okay. I see you dropped off your urine sample, so we'll make sure we start that test and get that going while we're doing your assessment. No vaginal concerns, no irregular bleeding, nothing like that, right? Okay. And you're okay if I do just a general assessment? Okay, thank you very much. I'm going to put some gloves on. We'll test that urine, and then while the urine test is running, we'll do the exam, okay? Awesome. So, let's get these going. Do you have any questions at all before I get started on the exam? Everything seems pretty straightforward. Good. Urine, and this is what will tell us if there's any bacteria or blood. Okay, so we will wait for that. Basically, I'm just going to be starting. I'm just going to expose your belly here a little bit. I know you've kind of been having that fullness and pressure, so I'm just going to do a little bit of pressing or an abdominal exam, if that's okay. Good. Okay. You let me know, of course, if you get too uncomfortable. We're going to start with just some superficial pressing. Press a little bit more. This general area is where you're feeling it. Okay. That is where your bladder is. Have you had any change in bowel movements at all? Constipation, diarrhea? No? Okay. Next, I'm just going to do some percussion. Next up, I just want to grab a pen light and assess the skin. Okay, so just the skin inspection of your belly here, especially where the pain is. Just making sure I don't see any redness, signs of irritation or infection, obvious skin changes. skin exam is looking normal. I also don't see any, new onset moles or, again, any abnormal lesions. So, okay, very good. So the next thing I'm gonna wanna do is just tap on your back. Do you think you're able to kind of roll to this side where your back is exposed to me? Okay, yep, just roll a little bit more. Awesome. All right, you let me know if any of this is painful. Pain? Good. Pain? Pain. Okay. Okay, so no flank pain. That's very good. All right. Would you mind if I just assessed your lymph nodes in your neck area here? Yep, just want to see if it's swollen at all. Get behind the ears here. Okay, very good. Awesome. And then general inspection, everything looks healthy. Look straight across for me. Good. Excellent. Let's go take a look at that urine sample. The results should be back. Alrighty. And just as suspected, it looks like you have some blood and bacteria, which is highly indicative of a urinary tract infection. Really, our biggest goal when seeing patients with UTIs is to make sure that we're not worried about a kidney infection. And these people will often have fever, flank pain or sharp back pain when I tap on them, chills, generalized fatigue. It would appear that you are very, distressed or uncomfortable. So it looks like we are dealing with just a urinary tract infection. So let me put this back here, and I'm going to take these gloves off. You haven't had a urinary tract infection before? Okay, yeah, they could definitely be very, very common. Normally what I recommend to all my patients is staying super well hydrated. Anytime that you have intercourse, you want to pee directly after. Even if you feel like there isn't much in your bladder, you want to at least attempt to pee, maybe wash the outside. And then when you use the bathroom, you always want to wipe front to back, never back to front, because that could risk transfer of bacteria. Does that make sense? Good. And then the other thing is, I don't know if you're someone who does this, but when you have to use the bathroom, you want to avoid holding it for a long period of time without going. Yes, that gets a lot of people. All right. So I do have some antibiotics for you to take. You are going to want to take these antibiotics twice a day for 5 days. Do you have any allergies to medications at all? Okay, awesome. All right, so I will write the plan here so the girls up front know. I'll give you these antibiotics right now to get started. Please let me know if your symptoms seem to worsen or the antibiotics are not helping, okay? Yes, and we'll actually be sending your urine culture out to make sure that the antibiotics we prescribed for you today are good at treating the type of infection that you have. Absolutely. Do you absolutely have any other questions at all before I step out, or everything makes sense? Very good. I will also make sure that up at checkout there's some patient information for you regarding how to prevent UTIs. And then other than that, you should be all good to go. It is not a problem at all. I will give you some privacy here to get dressed, and then the girls will see you at checkout. You're very welcome. Have a good day.